So my name is Tammy Combs. I'm a health science instructor at Lee County Area Technology Center. Our title is Advanced Virtual Healthcare. I have 3 senior students with me that have been with me since sophomore year. Don't think you guys come freshman year, do you? Lindsay Combs, Makisha Bachner, and Kelly Helton. And the reason I brought them is because the theme of this seems to be student engagement and money, and we need both. So a few years ago, I actually got in on another grant and done some of this stuff, and it was wonderful. So the name of it is called Cyber Surgeons, and it provides authentic ways for the high school students to apply science knowledge and skills. And in the mission that they do for this curriculum is based on national and state standards, and it relates to human body systems and disease processes. So I teach anatomy and physiology, medical terminology, and nurse aid, which all of these students have taken. So when I was preparing for today, I had the students come in and I pulled my stuff from what I had done prior, and we talked about the lesson, and they remembered me doing some of this stuff for the other kids and how they enjoyed it. So I said, let's pull the lesson, let's put it together, and I'm going to let them talk about what we're going to do, and I'm going to let them implement this with my younger students.
I'm Lindsay, as she said, and Cyber Surgeons is a learning experience that engages students in live stimulation to quickly diagnose and treat an array of medical cases. With the help of computers, internet, and video conference connection, webcam, and students' interaction, there is a chief medical officer from the Challenge Learning Center. Together, the teams of students learn critical thinking and scientific knowledge to solve emergency medical problems. Medical charts play an important role in patient care. A complete medical chart allows the physician and other medical personnel not only to review the patient's immediate health issues, but to also review the patient's history, past doctor visits, and hospital visits. The other important information is allergies and medications. This type of information is vital to providing good health care. Students participating in Cyber Surgeons' mission usually fictional patients' medical charts to diagnose the condition. This activity allows you to become more familiar with the components of charts and to realize how integrated charts are effective to patient treatment.
We will have 4 teams, Charlie, Alpha, Delta, and Bravo. Each team will consist of 4 members, a diagnostic specialist, a med-surg specialist, a clinical intervention specialist, and a case manager. A case manager receives patient charts from the chief medical officer. They review each chief complaint, set of vital signs, patient history, and physical exam results. They can either accept the case for their team or pass it on to another team. If it is accepted, the case manager directs the patient care through the process through the diagnostic and treatment phases of the medical care process. They maintain patient flow through the teams, update the patient status charts for their teams, and facilitate communication.
The next stage is clinical intervention specialists. They use a database to correlate patient symptoms and diagnosis with the most promising treatment protocol. Teams' options include first aid, surgical procedures, medication, and therapies. Based on the test results and final diagnosis, the clinical intervention specialists evaluate all recommendations and decide on the best course of treatment.
The med-surg specialists receive a patient report form with an initial patient diagnosis from the diagnostic specialist. They review X-ray and lab results, interpret the test, and finalize the diagnostic process. If a diagnosis is not confirmed, med-surg specialists work with the diagnostic specialist to revise the diagnosis and order more tests. Once a final diagnosis is made, they pass the case on to the clinical intervention specialist for the last phase of patient care.
And for the last stage, the diagnostic specialists access a database that connects symptoms with possible disease conditions. Team members evaluate patient symptoms described on the medical chart, identify the initial diagnosis, and order appropriate lab tests. Members then communicate with the case manager to give and receive information and update patient status to pass case to med-surg for next step for care.
So all of this is done through teleconferencing. When you purchase Cyber Surgeons, you can either use Skype or Zoom. I use Zoom. We'll do a pre-conference and make sure that our equipment's working. And then on the day that we plan this, they actually schedule it. So it'll be a scheduled day. All students will know. All of the patient charts will be put together for Alpha, Bravo, Delta, and Charlie. We can have as many as 30 students divided into 4 groups. And when the girls were talking about moving a patient from the beginning to the end, the students actually bring in a patient. They each have a Chromebook, and they have to move them through, just like if they were coming to the doctor's office or a hospital. And they can't move through until the prior person has done what they needed to do. So it's working together, and then at the end formulating a diagnosis. So when we're conferencing, the doctor is on the other end, and they will bring the chart to the doctor, and he will say, tell me what you have. And they use the charts. We have the examples up here. And they tell them what the diagnosis was, what the symptoms were, what they think it is, and what they've done. And he will say yes or no. So at the end, they actually have a conclusion, and they've done something. So they've diagnosed. Either they have or they haven't. If they haven't, he'll say, think about this, and go back. So they work together. So it's a lot of fun to see the kids work together and do that. And on my end, I feel like I've taught them something too, and how to find resources, and they can ask me or we'll look up in books as we're working, but I walk around and help them. So I think you did one, didn't you?
I've done it twice. Well, I've done it twice actually, and I've done it once in my science class, which was my first time ever doing it. And being able to go around like through the group and being able to like talk to each person, like you have a title of what you actually are when you're going through this. So like the diagnostic specialist, you can't diagnose the patient if somebody else has done something wrong. So you have to send it back down the line. And then you have to go back and redo it. And you go to the doctor and they say, well, it's wrong. So you have to go back and see where it went wrong at. And then you have to send it back through the line to get everybody to be able to fix it the way it should be to be able to get the right diagnosis. So it's pretty cool.
Any questions?